Hello, hi, it's Dr. Erica. Thank you for joining me on this particular video. I will be talking about um, vaccinations, immunizations, when to administer. Is it safe to administer two shots at the same time, or what cases may where that may be indicated, and which cases where that may not be indicated? Okay, so I'm Dr. Erica, pharmacist, founder of Millennium Pharmacy. My website, www.themillenniumpharmacy.com, is available for your pleasure. Please visit that website. Take a look at some merchandise that I may have. Also, any pertinent over-the-counter medications, medical devices that you would like to receive, please let me know. I'll be happy to get those items for you. Again, please thank you for joining me. Please subscribe, hit the button in the corner there, share with your family and friends, and also like this video. Okay, so I am a pharmacist and I've been practicing for close to 10 years. I have recently gone independent for myself in business. And so, as far as I'll just go ahead and jump into the topic so we can get through the video. It's very simple. When you receive a vaccination, what you're going to do in pharmacy setting is you're going to walk in, you're going to address the pharmacist or pharmacy staff to let them know your interest in receiving a vaccination. Now, they may, as policies um, present, may suggest additional vaccinations based upon your criteria, your age, medical history, medication regimen, things like that. So they may make a suggestion for additional vaccination. Okay, additional vaccinations may be covered by your insurance, they may not. You have to take a survey, things like that. And then once all that information is gathered, you may decide, okay, yes, I'll go ahead and get this vaccine plus this vaccine plus this vaccine, uh, more than two vaccines at a time. Or you just may want to decide to get one vaccine in a day. But if the case presents where you're able to get two vaccines, the pharmacist will go ahead and give you two vaccines in a day to help with compliance, to help keep you up to date and um, um, able to withstand allergens and viral infections that are out there. We want to make sure all patients, as pharmacists and healthcare providers, are able to get vaccinations right then and there, not having to wait. So, in cases where there may be a chance for a patient to get two vaccines, is going to be when the vaccination, totally depends on the health of the patient first, how they feel that day, what activities they have to do after receiving the vaccines. That is going to help determine how many vaccines they'll receive in that day. Also, the vaccine nature itself, whether the vaccine is a live vaccine or the vaccine is a dead vaccine. So if the vaccine is live, then usually the second medication will have to wait 2 weeks, 2 to 4 weeks after receiving the live vaccine. If the vaccine is a dead vaccine, then both medications, if they're dead, can be given on the same exact day, no waiting, no period of um, having to wait and come back, things like that. So that is the case. First, it depends on the health of the patient. Second, it depends on the nature of the vaccine. Again, if the vaccine is live, then it's recommended by the CDC to wait 2 weeks, 4 weeks to make sure that that live vaccine does not cause the immune system to be overloaded. If the immune system is overloaded due to the live vaccine, then there may be a chance that that second vaccine will not be effective. Okay, so do be aware of that. Also, I want to just make mention, before receiving a vaccine, go ahead and pre-medicate with the Tylenol or with the aspirin, maybe an hour before the vaccination, to be sure that you don't develop a fever, you don't develop any type of muscle pain or any type of irritation at the injection site. So do be aware. that you are able to pre-medicate with Tylenol or ibuprofen or NSAID or an aspirin ahead of time. Also, I want to make mention to get plenty of rest after receiving vaccinations. They may cause fatigue, tiredness, somnolence, may cause just tenderness at the muscle site, um, things like that. So do be aware of that. Um, and most vaccines are given to patients who qualify. So if you qualify for one vaccine, um, we'll make that suggestion and you can answer that question yes or no, or that you just want to take your time with getting your vaccines. But usually we're going to, as healthcare providers, advocate for the dosing to be given simultaneously or together on the same day for efficacy purposes against viral infection. So that is the answer to the question. Is it safe to take two vaccines? And yes, it is. But however, it depends on the vaccine and the health of the individual. Okay? So thank you for joining me. I hope this information has been helpful. Please like, share, and subscribe. I'm Dr. Erica. See you on the next video. Bye-bye.